And joining us now to talk more about these new treatments is Dr. Anthony Santella from the University of New Haven. Doctor, thank you for joining us. A lot of folks have questions about these pills, and I think, first of all, the biggest one is, what is the difference between the Pfizer pill and the Merck pill?
Well, both pills are really to treat people who have COVID symptoms, mild, moderate, and to prevent hospitalization. So they essentially do the same thing. Now, while I know there's a lot of shiny lights around these new pills, and while I anticipate in the future there'll be a game changer, right now we have to kind of sit back and be a little patient. The manufacturers still need time to develop them. They need to get into the shelves. Clinicians and other prescribers need time to figure out, who's the best candidates. And it's not for everyone, right? You have to be within the first few days of having symptoms. You have to meet certain eligibility criteria based on age, comorbid conditions. But it should prevent people from going to the hospital needing that intensive care, which is very much needed, particularly as we talk about hospitals and health systems really being fully occupied and really at the brink of collapse.
Now, I noticed you mentioned the word symptoms because we have been seeing people with breakthrough cases, even if they're boosted, who don't necessarily have symptoms. So I'm taking that to mean that you're saying that those people would not be candidates for these pills.
Yeah, no, this is for someone who is experiencing symptoms, is under the care of their primary care provider or other clinician. And when that clinician has made the call that, your symptoms are progressing, and in order to really keep you at home and in the comfort of your home in recovery, we're going to give you this treatment to prevent you from really needing that more intensive care. So this is not something that you or I can just go to a pharmacy and buy over the counter.
Now, are there risks associated with taking these pills?
Well, there are risks with every medication. That's part of the clinical trials process where scientists and clinicians study how these different compounds impact our bodies. So one of the differences, to go to your earlier question, between the two pills is that the Merck pill really is not advisable for people of childbearing age or who anticipate, getting ready to start a family soon, just because we know the impact that those compounds have on an unborn fetus. So at the end of the day, a clinician really needs to make this call. And it will take time for our primary care providers, our urgent care providers to really know enough about the medication, feel comfortable with it, and diffusing that information out to their clients.
Do you feel eventually, though, as this becomes more widely used, that this will be the type of thing where people will test positive, have some symptoms, call their doctor and get the pill? Will we get to that point eventually?
I do. I do, especially after people feel more comfortable with it. One thing COVID has taught us that the American public is a bit skeptical about new interventions, new medications. Things are kind of, hot off the presses. But I urge everyone who's listening to this to remember that our scientists, our clinicians, this is what they do. This is what they've gone to school for many, many years. And we, as the public, really need to give them the space and the resources to do their work effectively. So when this new medication has gone through the FDA approval process, I trust it. If my primary care provider were to recommend this, should I get COVID and have symptoms that warrant it, I will trust them. And I think we just need to err on the side of caution and really give that provider community our trust right now.
Very good thoughts. Dr. Anthony Santella, thank you very much for joining us, and happy holidays to you and your family.
Thank you.